Breast milk letdown or lactation is a natural physiological process which gets initiated the moment the placental hormones are withdrawn from the woman's body at the time of delivery. And the moment this thing happens and there is a stimulation of suckling of the baby onto the nipple, milk letdown should start. However, one has to remember that in the first 48 hours, this milk is not a mature milk which the woman will get. It is a little thin milk which is also called as colostrum, and that watery yellowish colostrum is also important for the baby's growth because it has very rich amount of antibodies, and it also contains sugars so that the baby maintains its sugar levels in the first 48 hours. Some women find difficult to make this milk, and many a times this difficulty is observed in women who have had a little not so pleasant antenatal course, like they had a growth restricted baby, or they had some disorders, or maybe they were too worried, very anxious even during birth. In such situations, the milk may not come. For successful lactation to be established, one has to have the right attitude, a positive attitude, and a serious intention of feeding the baby onto the breast. It requires a little patience, and it's actually the first ever lesson that both the mother and the baby are learning together. So this is the first lesson which the mother can teach the baby to suckle, to be able to lactate, and that will go a long way in helping the baby nurture it healthily and prevent many disorders in the baby in future. So if one has the right information and the knowledge and the attitude, breastfeeding should not be a problem. There are certain medications which can help you to bring forth this breastfeeding, which your lactation consultant or the gynecologist can guide you.